So when analysing clinical data, how much better are clinicians with all their training at avoiding bias and framing effects compared to non-clinical stroke medically unsophisticated people? Do you think twice as good? 10 times as good? What do you think? Well, the answer you might be very surprised to hear is there's no difference whatsoever between clinicians and non-clinicians. So for the detail behind this study, please do get the Daniel Kahneman book, Thinking Fast and Slow. And here's just a quick overview of this one study. There are several studies in the book. So lung cancer is the topic, and clinicians have the option to go with or recommend surgery or radiation. So they're all given information to read, which it clearly shows that surgery is much more effective over a 5-year study period. But in the short term, there's a little bit more risk with surgery than there is radiation. This cohort in the study, after the information that they've read, they're split up, and then half of them are given this statement and half of them are given this statement. So half are told that the 1 month survival rate is 90% for surgery, compared to the other group are given there is a 10% mortality in the first month for surgery. So just the difference between the words survival and mortality make a huge difference on the decisions of these groups of clinicians. So where it's a positive slant, survival, surgery is opted for 84% of the time. But just that slant of a negative word compared to a positive word drastically changes the decisions made. So from 84% to 50%. In reality, that's no different whatsoever from other people that are not in the medical field. That this was mainly done in a management school at university. So really interesting that framing and bias hits our clinicians just as hard as everybody else, even in the clinical world with clinical data and clinical language. Fascinating.